Before getting to the differences, let's talk about what these illnesses have in common. Johns Hopkins Medicine says the coronavirus and the flu share a few symptoms, such as cough, fever, and aches. They also say the viruses have similar methods of spread. However, Dr. Josh Meyerson of District Health Department No. 4 says the newness of the coronavirus, as discussed last week, lets it spread faster and cause more harm than the flu.
No humans had had previous infection to it, and what that means is that there was no immunity built up in our population. And without that, it can rapidly spread from person to person and quickly overwhelm a community.
And while both have relatively low case fatality rates, currently 1.9% for COVID and 0.1 to 0.2% for the flu, Meyerson says people need to remember how large that can be for a population in the hundreds of millions.
And although that may seem small, 1 to 2% of the population leads to thousands of unnecessary deaths.
He also says to keep in mind that these rough fatality rates show COVID-19 is about 10 times deadlier than the flu. Additionally, the coronavirus has a wide range of other symptoms the flu doesn't cause. These symptoms include a loss of smell or taste, swelling in the fingers or toes, and rashes. Finally, one of the biggest differences between these diseases is COVID-19's lingering effects after recovery.
A lot of people who are infected with COVID, unfortunately, do have long-term complications. They can have complications to their lungs, to their heart, their kidneys, and even their brain.
We'll be learning more about these complications in next week's installment. In Alpena, Kent Davis, WBKB News.